Let's talk about one of the most secretive countries in the world and what happens when COVID hits. North Korea says it's kept the virus out for the last 2 years, but not anymore.
North Korea has acknowledged its very first cases of COVID-19.
Supreme Leader Kim Jong Un said the country faced great turmoil and ordered a lockdown of all cities. No one's vaccinated, testing capacity is seriously limited, and the healthcare system is weak.
WHO is deeply concerned at the risk of further spread of COVID-19 in the country.
It's already an economically impoverished country, so it's just going to make matters worse.
So what do we know about what's happening? And did North Korea really keep COVID out all this time? Here's a throwback. It's January 20th, 2020. A new coronavirus has been identified in China, spreading from the city of Wuhan. There have been 282 confirmed cases across 4 countries, and the world is only just starting to make sense of it all. But North Korea takes action.
Even before the Chinese authorities locked down the province which Wuhan is in, the North Koreans stopped all travel and sealed their borders. So this is not something new. They've done the same thing for SARS, MERS, and Ebola.
And North Korea basically kept this up until January this year and says there were 0 cases in all that time. But the thing about North Korea is that it's almost impossible to get accurate information. And there have been various reports of COVID cases there over the last 2 years.
There were a lot of reports about fever outbreaks or people getting sick in a certain city, and the residents didn't really know if it was COVID, but they suspected it was COVID.
What we do know is that on May 12th, the government admitted it had a problem. It announced it had detected the Omicron variant and it was spreading fast. And some North Korea watchers reckon that 2 big public celebrations back in April could have been super spreader events. Since the big announcement, state media has been reporting daily figures for what they're calling a fever. By May 18th, they'd hit the 2 million mark and confirmed 63 deaths. But the number of new cases appeared to have peaked a couple days later. Keep in mind, though, these figures come with a couple of caveats.
So there's a little asterisk every time we talk about new cases in North Korea, right? Because what they're reporting are the number of cases with fever. And it speaks directly to the fact that they completely lack capacity to monitor and run tests on these cases to confirm.
As with anything that's dealing with North Korea and the internal situation, we're basically going by what the North Korean government is publicizing to its internal and also its external audiences.
Now remember, Omicron is less deadly than earlier COVID-19 variants, but it's super infectious. And North Korea is particularly vulnerable.
No one has been vaccinated, so it's going to rip through the population.
The leadership has repeatedly refused offers of vaccines, including from COVAX, the global vaccine program.
Their refusal to vaccinate their population was really based on that, the belief that the prevention would work and could stay on until the pandemic is over.
I don't know if it's as much of a concern about their reputation abroad or the being beholden to a foreign party because of receiving vaccines. It might just be because they don't want to risk personnel and foreigners coming into the country, going around the country, typical concerns about seeing the real state of things.
And then there are the problems with North Korea's healthcare system. Now, by some measures, it's not too bad for a low-income country. For example, they have plenty of trained doctors, nurses, and technicians. But they're dealing with serious shortages, including of basic drugs like paracetamol.
The other thing is the lack of resources in terms of medical equipment, being able to exchange information with outside world, that's also severely limited. And then on top of that, you have the international sanctions, which also shackles North Korea's ability to get parts for some of the equipment.
I've seen a lot of photos of clinics in rural parts of the countries, and they look extremely dire. No stockpile of equipment, really poor equipment and supplies, very dirty, not sanitary. That could be common in some certain rural areas. In bigger cities, there are of course hospitals, but I just don't think that they're up to international standards.
Another thing to remember is that this virus is sweeping through a population where millions of people are malnourished, 42% according to the UN. North Korea has always struggled to feed its people, and over the last 2 years, there have been extra problems. North Korea depends on imports from China for many staple foods, but when they shut the border to keep out COVID, it also meant a lot of that food wasn't coming in. A drought in 2020 and floods the following year hurt farming and hit production. And when you've got a population that's not well fed, they're going to be more vulnerable to disease.
We know, for instance, in case of the tuberculosis disease, that North Korea is one of the countries with the highest burdens of that. And that speaks to the sort of overall weak immune system of the North Korean population.
So how is North Korea tackling its COVID outbreak? Well, the government launched what it's calling a maximum emergency epidemic prevention system. It includes a national lockdown, with shops, restaurants, markets, and schools reportedly closed. But as always, it's hard to know exactly what the picture is and the differences between the cities and the countryside.
I haven't seen any evidence that police are setting up walls or boarding up doors of buildings like we've seen in Shanghai recently, for example, but we've seen blocked off streets, a lot of shots of empty streets. It's really unclear at this point, but it seems to be that there's nationwide lockdown, regional lockdown, but then potentially exceptions.
State media has released video of a factory that's still running and grocery stores and pharmacies that are open. The army has been drafted in to deliver medical supplies. There's also a public information campaign on things like social distancing and washing hands and recommending gargling with salt water.
이 전염병의 특징과 굿 임상 경과, 약물 치료와 관련된 상식적인 문제들을 알고 싶어하는 데 맞게 대중 보도 수단들을 통해서 이와 관련된 내용들을 집중적으로 알려주기 위한 사업들을 공세적으로 벌이고 있습니다.
Now, when it comes to outside help, there have been plenty of offers, including from South Korea, the US, and the WHO, but none have been accepted.
We've offered vaccines. We've got no response.
We have offered support in the form of technical assistance, in the form of medical supplies, tests, vaccines, and we are ready to deploy those.
The problem is less about the world's openness and the readiness to help the North Korean population. It has more to do with the regimes just being completely closed to any form of outside help that is going to, one, expose the vulnerabilities of the country, and also, two, it's also going to reflect poorly upon Kim's own competence as a leader.
But North Korea may have already turned to its closest friend, China, for support. It looks like 3 cargo planes from the state airline recently made a trip to China. They're thought to be the airline's first flights out of the country in the last 2 years. Reports from South Korean media suggest they could have been picking up medical supplies. 10 days after North Korea announced its first COVID cases, state media reported that they're successfully overcoming the crisis, that the government's response was working. The official tally showed the number of new cases coming down and a total of just 66 deaths. But again, this is North Korea we're talking about. And its track record suggests we need to be extremely cautious about trusting the leadership to be transparent when dealing with a crisis. In case you missed it, take a look at our last episode on the tragic killing of Al Jazeera's journalist Shireen Abu Akleh.